Hello friends, welcome back to your own YouTube channel Ask Your Gynecologist. I'm Dr. Sonal Parihar and today we are going to discuss the last part of the video PCOD. And what is the topic today? The topic is what will the doctor advise when you go to the doctor with different complaints. Now it all depends what kind of complaint you're suffering from. You might be suffering from menstrual irregularity, you might be having lots of weight gain and you know it is PCOD, or you may not know it is PCOD. You may be suffering from lots of acne, hirsutism, unwanted hair on the body. You may not be getting pregnant after getting married. So all these problems, when you go to the doctor and she comes to know that you are a PCOD patient, the line of treatment will definitely differ. Okay, so let's start with weight gain. If you go to a doctor and tell her that I'm gaining suddenly a lot of weight, I'm not having regular periods, probably that is a point, or just a lot of weight gain, maybe after marriage I've started eating something different, or the hormones have changed, there's something different, doctor. I'm not thyroid patient, I've got my thyroid checked. What will the doctor do? Well, the advice to a patient who is just getting fat without any PCOD is different. Advice to a PCOD patient is different. As we discussed last time, you have to change your lifestyle. Dietary modification, lifestyle modification, the exercises, the kind of yoga, the gymming and all that you are doing, that is normal for every patient who's getting fat. But for you, you will be getting some more treatment in the form of medicines. Now, what are the medicines which help in weight reduction? There may be certain medicines which cut down the amount of fat that you are taking, which burn the calories, the fat that you are taking. But that is, of course, not specific to the PCOD patients. That may be advised to patients who are like normal women who are gaining a lot of weight and not able to cut down the calories. So these are certain drugs which are available in the market. For PCOD patients, we normally advise a drug called metformin. Now, metformin is a drug which is normally given to diabetic patients. Sometimes you might get confused and talk to the doctor. Doctor, have you given this purposely, or is it just by mistake that you've written it? Because it is not a drug for me. It is a drug for diabetic patients. I'm not diabetic. Now, this drug has been proved from so many years that it helps in PCOD because it decreases your sugar level. It increases your body's sensitivity towards insulin, and definitely it helps in weight reduction as well. And in case you are married and you're not getting pregnant, or somehow you get pregnant, this drug has to be continued. You cannot stop it because it helps in preventing miscarriages. Okay. Now, the second common problem with which you will go to the doctor is acne. You're getting a lot of acne, which normally decrease when you start menstruating, and then unwanted hair on the face or on the body. This is because of high androgen level. So obviously the medication has to reduce the androgen levels in your body. So the most important medication that we use here is cyclotron acetate. Now, this does not come as a single drug. It comes in a combination with OCPs. It is combined with the other hormone estrogen, and it is given as a form of OCP, that pills of 21 days. So what does it do? It first of all regularizes your menstrual cycle, because this is what we give when we have to regularize the menstrual cycle. It is not only meant for married women, it can be given to unmarried young girls as well, because it regularizes the cycle. It reduces the androgen level and the hormone imbalance that you are having in your body. Secondly, it also reduces the amount of acne and the unwanted hair, but definitely it's not going to completely cure it. So it is just a very temporary treatment. So for all the women who are suffering from PCOD, you have to regularly visit the beauty salons where you go for waxing, for your threading or your electrolysis, laser treatment for the hair, unwanted hair. But of course, your visits will be more than as compared to a woman who is not suffering from PCOD. A lady who goes probably once a month, you might have to go say every 10 days or 15 days because of these hair and acne problem. You might even consult a skin therapist. They might help you, right? Coming to the third main complaint with which you will visit a doctor would be menstrual irregularity. Now that is very common, as we have discussed in the previous 3 videos. A teenage girl, young woman, even ladies who have already had their children at the age of 30, 35, they might even come with menstrual irregularity, depending upon when their PCOD, this disease manifests in their life, right? So first of all, treatment would be pills, which we just discussed, and they normally contain cyclotron acetate because it helps in weight reduction, it helps in getting the androgen level down, so it fights with the PCOD problems in your body, right? So OCPs. Otherwise, if you want to conceive, then definitely the OCP period has to be reduced to say 3 months, 4 months, and then you start getting drugs for getting pregnant. Now, if you are not able to conceive, so what is the treatment? To a normal patient who is not able to conceive, we normally give clomiphene or letrozole. These are the drugs which help in increasing the egg production in your body. But for a patient who is of PCOD, she has to get some supportive sort of treatment. Apart from these two, clomiphene and letrozole, you would need myoinositol, you would need metformin, you might need berberine. So these are certain drugs which are there in the market, which reduce the effect of PCOD, which reduce the effect of androgens in your body, and increase your body's sensitivity towards insulin, and kind of stabilizes your hormone imbalance which is there in the body, right? So these are certain medications which a doctor would give you, which will help in everything, like in weight reduction, in getting pregnant, in regularizing your menstrual cycle. But of course, you have to take care of your body's metabolism. You have to take care of your lifestyle, the diet that you're having, because everything will together help in fighting with PCOD. It is not just medications. Right? So I think today we have discussed all the salient manifestations which you would normally have as a PCOD patient, and what will be the doctor's advice. So till then, if you have any question, till we come with the next video, you can always inbox me in my channel, Ask Your Gynecologist. I will definitely try to answer. Or you can also advise me that, ma'am, I want to listen to this topic. Please make a video on this particular topic. Next time we'll get that video. Right? And you can also follow me on my Instagram handle sonal.parihar.33. Till then, take care. Bye bye for now.